shelter for a man with trouble breathing. You arrive to find a 56-year-old man sitting in tripod position at a picnic table in moderate respiratory distress. He is speaking in 4 to 5 word sentences, and he states he cannot catch his breath. He tells you he's supposed to be taking medications but cannot afford them.
Okay, so proper PPE, be a size, may seem safe.
Yes.
Okay, nature of illness is going to be respiratory distress. I see one patient. Do I have any more?
Just one.
Okay, I am going to request ALS, and I don't feel that it's necessary to put a CCAR on at this point in time.
Sure.
So I'm going to go into my general impression. So I have a 56-year-old male that's in respiratory distress. And then I'm going to go to his responsiveness. So is he talking to me? Is he just responding to verbal stimuli?
Responsive.
Okay. And then can you tell me what your chief complaint is? Like, what's bothering you the most?
I just can't breathe.
Okay. And then now I'm gonna go into my ABCs. So I'm gonna assess his airway. He's talking to me, so I know it's patent. I'm gonna assess his breathing. So I would be looking for adequate rise and fall of the chest. And I'm gonna also listen to lung sounds. Deep breath in. How do his lungs sound?
Rails in the bases up to midsection. You have noisy breathing heard.
And then for circulation, so I'm gonna check his radial pulse. How is that?
Pulses are present, rapid, and strong.
Okay, and then I'm also going to note any major bleeding at this time. Is there anything noted?
None.
And then his skin color, condition, and temperature.
Pale with cyanosis around earlobes, cool.
Okay, so this patient is in shock right now, so I'd put him in a supine position. I'd put a blanket on him, and I would also administer high concentration oxygen via non-rebreather at 15 liters per minute. So he's going to be rapid transport, high priority, and then I'm going to go into my sample taking. So was this sudden? Was this gradual? When did this kind of all start? Was it
60 minutes ago.
okay? And does this pain, does anything make it worse? Does anything make it better?
Lying down makes breathing worse.
And then can you describe this pain to me? Is it sharp? Is it stabbing? Is it aching? Is it dull?
A stabbing, slight chest pain.
Is the pain radiating anywhere?
No.
Okay. And then severity scale 1 to 10, 10 being the most pain you've ever felt in your life before.
I'd say pain is a 3, but difficulty breathing a 9.
And then you said this started about 60 minutes ago, right?
Yes, but I've been sick for about 3 days.
Okay. And so the signs and symptoms is that you can't breathe, right?
Mm-hmm.
Okay. And then do you have any allergies?
Cypro and cardiac dye.
And then are you taking any medications?
I'm not taking any, but I was prescribed Lasix, Lanoxin, and potassium.
Lasix, potassium, and
Lanoxin.
And then do you have a past pertinent medical history, like anything with your lungs or your heart?
Yeah, I had water in my lungs once and a regular heartbeat.
Water in your lungs, you said?
Yeah.
Okay. And then when was the last time you ate something?
Lunch.
And then what what led up to this?
I was just sitting in my chair.
Okay. Okay, so I'm gonna focus on pulmonary and cardiovascular. He is in respiratory distress, but he did note that he had stabbing chest pain along with having water in the lungs before. So I'd want to take another look at his lungs to see if maybe the oxygen helped at all. You with me? Are we still noting some rails?
Yeah, still rails.
Okay. And then I would also want to assess, is the oxygen helping with his difficulty breathing at all?
Yes, SpO2 was originally at 85 and is now at 91.
Okay. And let's see here. So I would assess his breathing again, listen to lungs. If a paramedic was here, I would put a 12 lead on the patient just in case. Okay, 1 second. Okay, so now I'm gonna take my vitals.
Yeah.
Would it be okay if I took your blood pressure today?
Yeah.
One 115/80.
Corrected is 168/114.
You said 160.
68/114.
Will you tell?
Yeah. Sorry.
There you go. Okay, pulse was 65 and respirations were 13.
Corrected pulse was 124 Respirations were 26.
So my field impression is that this patient might be having congestive heart failure or congestive heart failure due to him having stabbing chest pain, and he also has a history of having water within his lungs along with irregular heartbeats. With his respirations being so high, I've already administered oxygen due to him being in shock, but I would maybe now consider switching to a bag valve mask and providing positive pressure ventilations. As far as his chest pain goes, I might consider administering a tap of nitroglycerin. His systolic blood pressure is high enough for me to do so. I would want to make sure he didn't take any erectile dysfunction medications within the last 24 hours. And I'm going to reassess this patient every 5 minutes. And then, does it have new?
Yes.
1 second. Okay, what are those?
170 over 110. Pulse is 120. Respirations are 30. And then SpO2 is 91.
Okay, so medic 1, we have a 56-year-old man that is possibly suffering from congestive heart failure. He is allergic to cardiac dye and Cipro. He is prescribed latex and potassium and Lopressor, but is not currently taking those. He has a history of lungs and water in his lungs along with irregular heartbeats. He is in shock. His respiratory rate is 30, blood pressure is 170 over 110, pulse 120, SpO2 is 91%. We are currently bagging him and we have administered 1 tablet of nitroglycerin and we're 5 minutes out.